And joining us now is Dr. Alan Tyroch, who is the professor and founding chair of surgery at Texas Tech Health El Paso and the UMC Chief of Surgery and Trauma Medical Director. Thank you so much for your time. Appreciate you being here to talk about a really important subject that I think a lot of people might not know about, and that's whole blood. So tell us, what is whole blood and how can that be a lifesaver during mass casualty incidents like the one that we saw on August 3rd and Uvalde?
Doctors were using whole blood in World War I and World War II. Over the next few decades, they quit using it and started using something known as component therapy, which means a patient would get either packed red blood cells, plasma, or platelets. Well, it turned out in the Afghanistan and Iraq wars, it was better for the soldiers to be receiving whole blood. So they started doing that because it's easier to just transfuse soldiers, injured soldiers in the field. When the trauma surgeons and ER physicians came back to the United States, they started saying, well, why are we not doing this in our trauma centers? And we started thinking, well, why don't we start getting this blood out to these patients who are injured at the scene or at small hospitals, start using the blood there, resuscitate, and then bring them to the tertiary trauma centers like UMC. We've been transfusing whole blood for the last 3 or 4 years now, and we have seen marked differences. Unfortunately, we did not have that capability in 2019 on the August 3rd event. Heaven forbid we had a disaster here in El Paso tonight or tomorrow, whenever. We could get multiple units of whole blood, not just from our regional blood bank, which is Vitalant, but also somewhere else in Texas. We could contact them. It's called TDEM, Texas Department of Emergency Management, and they could fly in a jet the blood to El Paso Airport. Somebody here would coordinate through the border rack and get the blood to the various trauma centers in the city to do that.